Welcome to Tech Talk. Today's episode is one I have been truly looking forward to because we are talking about a space that's been overlooked for far too long: women's health innovation. And joining me is someone who is working in this space, Dr. Laila Karra-Newton, the Chief Medical Officer at Aster. Welcome, Laila. Thank you so much, Laila, for joining the show.
Yeah, thank you so much for having me, Jazz. I'm excited to be here and just to talk to you and kind of see what you'd be interested in learning about Aster as well.
Yeah, absolutely. So, Laila, before we actually deep dive into the technical aspects, talk about your career journey, how you started, what are you doing now?
Yeah, okay. So I'm actually a physician by background. I've always been in medicine, and I have been a practicing physician for over 8 years now.
Mhm.
But my passion has always been in women's health. So when I started specializing after med school and everything, I went straight for OB-GYN and began my residency as an OB-GYN, and also did a secondary kind of degree and published some work for a global public health project, which I was working on with the WHO. We looked a lot at testing in pregnancy in rural areas and how that could be done more efficiently and at higher quality. So my background and my passion has always been in women's health and global public health. And I only ever really wanted to be an OB-GYN. So that's me. I didn't really see myself doing much else. But at some point, I was a practicing doctor in the hospital system and was pregnant myself and had a not so positive experience with the care that I was given. At
Mhm.
that time, there were a few things that were missed, a few things that weren't followed up correctly. And
Mhm.
it resulted in some, issues with my pregnancy and my delivery.
Mhm.
So as a doctor, it was a very awkward situation for me because I didn't know whether I should, speak up about it or I should just let it go. But actually ended up speaking up, investigating, and going through an entire process to look into what happened, what went wrong. And on the back of that, I learned so many things about how the system works.
Mhm.
And so, as a family, myself and my sister, who's actually the co founder of Aster, her name is
Mhm.
Fifi, decided that this was an opportunity for us to do something different, to do something that we could actually have an impact at scale and
Mhm.
really change the lives of families and women receiving care. So we started Aster. So this really is my first kind of company, the first time we've created something in the women's health tech space, and we've been running for 2 years now. So I went straight from being a practicing clinician to being co-founder and chief medical officer at Aster.
Great. What a journey. Are you still practicing your medical or you are all into Astro now?
Yeah, 100% full time in Aster. Yeah, I have kind of left clinical medicine at the moment. It's definitely something that you do miss when it
Mhm.
comes to the hands-on work and the fun things that we used to do. So, I do miss delivering babies and catching babies and cesarean sections and all of that. But yeah, right now, 100% full time into Aster.
Yeah, that's great. And I would also like to know from you that what differences or what gaps did you see and that motivated you to start Aster?
Yeah, absolutely. I think one of the things that we were quite clear on is that unfortunately the systems are not designed to
Mm-hmm.
allow providers to really give their best care. So
Mm-hmm.
it isn't so much that, you experience something because a particular provider is not doing their best work. They genuinely are most of the time. It's just that the systems have so many constraints that mean that you can't actually practice in the way that you want to, myself included. So
Mm-hmm.
that's things like being overworked, understaffed, having very limited time for your appointments. And honestly, the biggest burden that even myself and my colleagues would face was the admin. So
Mm-hmm.
all you'd want to do is see a patient. You want to see them, examine them, come up with a diagnosis and offer them a treatment, and then obviously follow up and see what happens. But
Mm-hmm.
what comes with that is a lot of documentation, a lot of trying to schedule and standing at the reception desk with their notes physically in your hand to
Yeah.
schedule the next appointment, which takes another 5 to 10 minutes of your day.
Mm-hmm.
And when you're doing that for 30 patients, you
Yeah.
could only imagine the backlog and the paperwork that comes along with it. So we were just trying to figure out, well, what can we do to take away that side of things and allow providers to feel more comfortable, to feel like they have time to be able to sit down with their patients, really engage, spend less time staring at the screen and more time staring at the patient and
Yeah.
really getting to know them and engage with them. So the gaps were really about timing, efficiency, follow-up and testing, things like that. So
Yeah.
that's what we've built into Aster.
Yeah, I think this is very valid point, and I personally have faced the same thing.
Yeah.
And the doctors are in so much rush. I would say that maybe because there are a lot of patients or they have a lot of admin work. So most of times they are in their system just putting on the details instead of talking to the patient. So that is something. If you're filling that gap, it's going to be really, really extraordinary and amazing. I would say that. But I believe that there are other platforms as well, right? Like Maven or Tia are doing the same thing. How do you differentiate yourself in that space?
Absolutely. So the interesting thing about Aster, a lot of people, when they think about women's health companies and innovation in women's health, a lot of it comes down to care delivery. So you
Mhm.
have amazing companies like Maven and Tia who are actually doing the care delivery,
Yeah.
seeing patients, enrolling them into programs and looking after them physically. Aster is different. So we are a software platform. So
Hmm.
we purely do just the technology piece. That means that we actually become the electronic health record system, the actual software stack that providers would use in their clinics. So
Hmm.
that could be anyone from a large health system, that could be down to a solo provider, nurse practitioner who's just doing telehealth, but it could also be a Maven or a Tia because everybody needs software to be able to actually deliver that care. And that's where Aster comes in. We have seen some amazing innovation in care delivery when it comes to things like menopause, fertility, pregnancy, postpartum. What we do is allow for all of that care to be run on a single platform.
I understand correctly. Do your platform is the one which is a kind of software, and it has got some predetermined things related to women's health, and it can be integrated to the providers' systems, right?
Exactly. So
Yeah.
right now we do actually replace their systems entirely.
Hmm.
So many providers will use an electronic health record system that traditionally has been created for multi-specialty care. So they
Yeah.
might be using something that's generally specialized for, I don't know, primary care, but all they're
Hmm.
doing is women's health. And so unfortunately, it doesn't quite work in a sense of with Aster, you have a pregnancy flow sheet. So you
Hmm.
can see exactly what happened at every single visit as it pertains to the pregnancy care that you're giving. You could see lab results specific for preconception. You could see lab results specific for hormone replacement therapy. And you can kind of track those things as you would need to for the care that you're giving specifically in women's health.
Hmm.
So that's why a lot of the customers come to us because they're not doing other specialty care. They're really focused on this one area. They're specialists in this one area, and they need a platform that recognizes that and makes it easier for them to give that care rather than making it harder and having them click multiple buttons just to document
Hmm.
a single visit because it's really about the pregnancy and how they measured the fetal heart rate, for example.
Right. That's pretty interesting. And I have some very interesting facts. And also, you know that there is a huge, massive gap between the inventions happening at the male
Yes.
health side and women's health side. So, as for McKinsey 2023, closing the women's health gap could really generate 1 trillion annually by 2040, right? Yet it is still viewed by many as niche investments.
Yeah.
So, why do you think that the investments and innovations happening at the women's health side are still very low in number?
Yeah, I think it's definitely something that has been kind of underfunded, chronically overlooked. I don't
Hmm.
know what the reasons are. I think we all have our ideas as to why that happens, but you can think about things like even women's health in itself doesn't
Yeah.
have much funding for research and
Yeah.
studies. Women are not included in many clinical trials when it comes to things like heart disease or when it comes to things like stroke, yet they experience those conditions more so than men. So if you're not having as much education, research, and kind of funding going into women's health, you're not going to be able to generate as much innovation and excitement and kind of move the needle forward. So that's kind of one of the reasons why I think the background doesn't allow for us to grow as fast as perhaps
Mhm.
in men's health. It's an absolute goldmine opportunity though, because women are
Yeah.
the decision makers when it comes to healthcare. So
Yeah.
if you're able to capture the women's health market and you're able to speak to the mother, the sister, the grandmother of that family, you do actually give yourself the opportunity to care for the entire family. So, in our opinion, of course, it's a great opportunity. It's something that is a real issue at the moment that people are really looking into.
Mm-hmm.
and are trying to get involved in. So yeah, why not now? Why not invest in companies that are actually focused on women's health today?
Yeah, I completely agree to you. And I was surprised to see the another fact which I will read out and which completely aligns to what you are saying. So, 2% of all VC in digital health went to companies focusing on women's health. It's only 2%. Even though women make up to 50% of healthcare. This is surprising. And I can't imagine that there is still biasing. And also, it has been said a lot of times that drug dosage are based mostly on the male psychology, right? It's not based on women's psychology, or the number is pretty less. So we can clearly set and see the biasing which has been done. And it's a great opportunity if inventions are happening at women's health side. It's going to be really, really impactful because the body of women is pretty complex and we go through a lot of changes, and inventions, innovations towards this is really going to impact the overall population. So tell me more about Aster. So it's been 2 years now. What are some of the technical aspects you're working on and how you're making a real difference?
Yeah. So, of course, Aster is 2 years old. We've probably been live and in market for about a year. And
Mm-hmm.
we work by offering our software platform to women's health providers and clinics. Right now, we have over 70 clinics signed up using Aster. One of the interesting things people like to hear is that we do actually offer labor and birth
Mm-hmm.
services on our platform, which means that you can technically deliver a baby on Aster. And we've had 250 babies born on our system. So,
Mm-hmm.
super proud about that. One of the things that we've noticed and we've been really, really excited is kind of the use of AI as clinical decision
Yeah.
support. What we do is use AI in very small and very targeted areas of our platform to assist the providers. So
Mm-hmm.
right now that looks like things like extracting lab results and doing interpretation on those results. So a provider doesn't have to sit there and type in or
Mm-hmm.
interpret every single marker, which can take hours and often is the role of a medical assistant or one of the team, and they would otherwise be able to do something else that's a lot more important on patient facing. Another area is in things like medical coding. Again, a mundane task that really providers shouldn't be doing. Like we're not trained, we're not
Yeah.
excited about, and our skill set is not to sit and code
Mm-hmm.
visit every time you see a patient. It's to see the patient and to deliver the best care. So Aster comes in and suggests codes based on what you guys discussed during your consultation and during your appointment.
Mm-hmm.
And you can just hit save. So we're trying to save people time, trying to be their assistant that's not in the actual practice and trying to get them to basically spend more time with patients and honestly to see more people. That's what we
Yeah.
want. We want women to be able to have better access to care, spend more time with their doctors and nurses and get to know them better and ultimately have better health outcomes. So very exciting changes happening across our platform now and thinking about how else we can really deliver better efficiency to our providers.
Yeah, absolutely. And who are you selling this to? Providers?
So anyone who is a women's health provider, so that could be an OB-GYN, women's health
Mm-hmm.
nurse practitioner, midwives and birth centers. So those are our main target group today. We find that private practice owners absolutely love Aster and they're able to jump on really, really quickly, which is amazing. But of course, we have much larger clinics and some health systems that are super interested because as mentioned, there aren't really dedicated tools for their women's health departments specifically.
So, Laila, thank you so much. And it looks very, very exciting. So, do you have something which we can see? If you don't mind sharing your screen and showing us how Astro really look like?
Yeah, absolutely. I'd love to show a little bit of our labor and birth flow,
Mm-hmm.
something that often gets used when somebody is delivering out of hospital. And I'll just share my screen and let you have a look at that. So, real quick, just to walk through here, you can see we have various different areas which you
Mm-hmm.
would document the events of this labor and then the birth. I'll talk you through a couple of things here. Many of us know what it looks like, what it feels like when your waters break. And this is an area you would click into as a midwife, an OB-GYN, or a labor and delivery nurse to timestamp that event. You would go through all of these labor milestones and collect the times. Seconds are super important when it comes to labor and delivery, so we collect all of that. We also track the patient's vitals, the fetal heart tone, so this is baby's heart rate, and look
Mm-hmm.
at the trends to do with that area. We look at examinations and even contractions. So you can imagine contractions are one of those things that is so important to know how they're progressing, how long they're lasting, and how often they're coming. And that's what we can
Mm-hmm.
track in Aster. One of the other things that happens when you have a baby that is born in Aster, we immediately create a baby record. Super
Mm-hmm.
important because after they're born, a lot of investigation, examination, and kind of reviewing happen for that
Mm-hmm.
baby. So in Aster, we create their record immediately. And of course, one of the biggest things about a platform like ours is data. So we
Mm-hmm.
collect everything about the birth, what happened, what was the outcome, where it happened, and did anything go according to plan or not according to plan with that. Things like transferring. Once we've done that, we move on to the immediate postpartum. And one of Aster's real key selling points is that we track what happens with the parent and the baby side by side.
Mm-hmm.
Traditionally, if you think about using paper, you'd have two sheets of paper. One would be for the parent and one would be for the baby. And you'd be writing all the investigations and the assessments about
Oh,
each.
is it till now happening on paper manually?
Oh, absolutely. In some rural areas, in some different, parts of the country, and even in other countries, there are wards and labor and delivery units that use paper. So you
Mm-hmm.
can totally imagine that although it sounds kind of archaic, sometimes it's easier to have two sheets of paper side by side than it is to swap between tabs and to swap between windows. Right now, if you were seeing a mum just after delivering, you would
Mm-hmm.
document all of her information, and then you would open up this baby chart, find the encounter, document all of their information as well.
Mm-hmm.
So we put them side by side. So that's something that we're super proud of, and it just saves a lot of time. And it just means that people are able to, again, focus on the care that they're giving, come back to their screen when they need to, click a few buttons and chart a few of the key areas of information and get back to the patient. So
Mm-hmm.
two of my favorite areas when it comes to using Aster.
Yeah, great. Thank you so much. And what are the measures of your success? How you're measuring success beyond just, engagement metrics?
Yeah, it's interesting. It's a platform like ours. There's multiple ways that you could potentially measure success, and I think longer term we will be looking more at the clinical outcomes. So
Mm-hmm.
we're super interested in, well, we've had this number of patients use the platform and this many babies born in this platform. What do our outcomes look like? Who's using us, and why are they looking so much better than perhaps hospitals? But right now, some of the great areas that we can measure are the amount of usage in each part of our platform and how long people are spending in each thing. So for us, that looks a lot like, how long does it take you to document a typical prenatal encounter? So that is, if you were in a hospital setting, you may spend 30 minutes documenting and typing up the
Mm-hmm.
visit that you just had with a patient. In Aster, that's currently 16 minutes. And we
Mm-hmm.
found that has cut providers' charting time significantly. And they're able to, as we said, spend more time with the patient or move on to the next person and add in a couple extra patients per day, which can equate to a large number of extra visits that they can provide.
Great, great. So, is there any AI element added to the software which you have just now shown when the baby is born or during the pregnancy? These are some of the factors, and then AI will say that, okay, this person is susceptible of having some kind of, I don't know, in medical term, what do you call, but the prediction basically. How is it going to be a normal delivery, or the baby inside is not doing good? So, maybe it would be cesarean, something like that.
Absolutely. So that's something that is a huge, huge, huge focus for us at Aster. And I think what we have kind of so far is a very rich data set of information about clinical risk factors, social risk factors, and outcomes. So one thing you must do when you're looking at trends and how to predict is to be able to have the start and the end points.
Mm-hmm.
For us, something like pregnancy is a great use case because you're able to see a patient very, very early on, maybe pre-conception, or
Yeah.
maybe very early, like 6 weeks after their pregnancy has started. And then you're able to see them not only at the birth to know what happened then and how it went, but also up to a year afterwards. So did anything else happen? Did any other complications occur? Right now, we're in the early stages of having outcomes on our platform, which is great, but we're already to extrapolate trends to see, for example, what type of patients have gone on to have the most successful, I say that in quotes because every birth is still something, let me tell you, but to have the most successful outcomes when it comes to the actual clinical outcomes. What areas in terms of geography have shown us that maybe there's been a lot more complications? Is there something around transportation that has led to issues with keeping up with appointments? So we're able to track those data points today. Of course, long term, we're looking at publishing, running our own studies, and having our data used to actually build in our own prediction into Aster. So that looks like not only clinical risk factors, but are also personal risk factors for
Yeah,
other
social
things.
factors as well are getting included. How
And
the
then
lifestyle is, how the social
100%,
impacts are. Yeah. So
yeah.
that's great and pretty interesting. So what's a moonshot for Aster for coming years?
I think for us, it's pretty clear. We would like for all of women's health to run through Aster. That's it. That's how simple it is.
One simple statement
That's it.
covers everyone.
Yep. And
Yeah.
that could be in many ways. Like we appreciate that, of course, large health systems, large hospital systems are
Mhm.
required to use certain tools. That doesn't mean Aster couldn't be a layer on top of that and couldn't provide the same efficiencies and clinical insights that we do already within those larger health systems. So that's how we're viewing the future of Aster.
Great, great. Very, very interesting. I think we covered a lot of things in just 23 minutes.
Nice.
Anything extra you would like to share? You did a demo, you covered what
Yeah.
Aster is, we have discussed about the gaps in women's health. And while I was doing research, all these statements and the facts which were coming really shocked me because I wasn't aware of this level of gap. So there was some gap, but this level of gap was there. It was pretty
Yeah.
surprising. So it brings immense happiness, to see people are involved in such kind of innovations where it's really working out well.
Yeah, absolutely. I think it's something that we're very dedicated to solve. I think we're one of many women's health companies that have a true personal connection to the problem we're trying to solve. And in Aster specifically, we're coming at it from a different point of view and trying to work with the providers to ultimately affect the patients. So yeah, super happy to kind of share our story and to keep working towards this goal. It's not something that we will stop doing. And anybody who would like to support not only us, but anyone working in the women's health space, we're
Mhm.
super grateful for that. And I think it's something that we need to see a lot more of. So would highly encourage investors out there, executives out there, people who are just interested in actually being involved in what looks to be the future of healthcare to
Mhm.
get involved and be a part of it in any way that they can.
Yeah, that's a noble cause, I would say. The work is really great you're doing. So, what is your audience right now? Who are you targeting to? Public health sector, private health sector, states, North America, or I know that you're originally from the UK, right? And you have been targeting there as well. Or what is the plan overall? Pretty curious to know all of these.
Absolutely. So right now we are US based and all of our practices are US based. They are in
Mhm.
the private sector, and that seems to be a good opportunity for us purely because we can get in, replace the systems very, very quickly, and have people start using Aster and seeing results as fast as possible. But
Mhm.
of course, we are looking for partners. We're looking for anybody who's in a large health system who would like to pilot our technology, whether that be clinical decision support tools, labor and birth flow, immediate postpartum, where we can actually have an impact and help them. Perhaps if they are understaffed or they're finding that it's difficult to have information consistently available for all of their providers. So anybody who is kind of struggling in a labor and delivery unit, whether you're an OB, whether you're a nurse, whether you're an executive, or you're looking at piloting digital health solutions, that's the type of conversations we would absolutely love to have. And then
Mhm.
aside from that, if you are a private women's health clinic who's looking for a new EHR system, but a little bit more, yeah, jump on board straight away. Yeah, super excited about the next steps here.
Yeah, great. And a very important point, which I want to check what are some of the challenges you are facing right now? So, investment side, we have seen the numbers, right? We have seen the facts, we have seen the interest from the people. So, what are the challenges coming from development or finding out the use cases till, getting a product ready to sell
Yeah,
overall?
I think there's an interesting difference between healthcare companies and
Mhm.
other tech companies.
Yeah.
So when it comes to healthcare, there are different metrics. The metrics are different because we're dealing with lives. We
Mhm.
can't necessarily go fast and break
Yeah.
everything because if you break everything, potentially the complications are very, very serious.
Yeah.
So for us, it just looks like having those investors that are truly aware of the problem, that really deeply understand the women's health market, who perhaps understand a bit more about what types of providers there are in women's health. Often we speak to investors who are super excited about the space, but maybe just don't quite have the understanding to know that our metrics may not be the same as a fast growing AI company in fintech, for example.
Mhm.
So just having that awareness is kind of key and can be a challenge sometimes. And ultimately, there is a difference in kind of the way that we can go about selling and go to market sales cycles can be
Yeah.
quite long. And that's just because, again, there is regulation involved and it comes down to health outcomes at the end of the day. So it's in somewhat more exciting, more interesting. We get to do a lot more that actually touches human lives, which is
Mhm.
the goal at the end of the day. But it can take some time. And so, yeah, just having that understanding and that knowledge is great.
Yeah, great. I think you have the clinical background, so you know the problem. So that one challenge is cut there, right? Otherwise, if somebody else is trying to build a platform, they need to get the domain knowledge. So, domain, you are already solid, and
Yeah.
whatever challenges you are having, you're just sorting it out. That's amazing. That's great. And yeah, what next?
Yeah. Well, this year we're kind of on the hunt for the next big customer at Aster. So really looking to get to know health systems, looking to get to know hospital groups, large women's health practices, fertility clinics. We've had a lot of interest from major fertility clinics who
Mhm.
unfortunately have been left without sufficient tools, which was something that I had more recently learned because, of course, my work has been in general OB-GYN. So very, very exciting spaces. We are looking at doing a lot of events this year. Something that we enjoy is meeting people in
Mhm.
person and meeting them where they are. We find we get a lot of connection and we kind of build our own community when we're at events, either speaking or exhibiting. Joining podcasts like yours as well is a great event for us to really share what we're doing here at Aster. So this year is going to be busy. Very excited for that, and just about us getting out there and pushing forward, really.
Yeah, that's great and sounds like a great plan. So, last question before we really wind up the cycle of women's health, right? From a girl to a woman, say like 60, 70 years, there are different types of problems. So, are you starting with pregnancy or are you starting with pre-pregnancy? I mean, what are the entities or what are the use cases you have been taken and you are planning to build more in the future?
Yeah. So for us, Aster is a platform that can be used for the entire life cycle of women's health. So that's
Mhm.
anything from pre-puberty all the way up to menopause and beyond, whether it be taking care of somebody who's looking for hormone replacement or is
Mhm.
concerned about gyne cancers. So our platform is designed that you'll be able to take care of a woman throughout the whole life cycle and the whole journey of
So,
her.
it is already designed full end to end.
That's right. I think
Okay.
the interesting part and the area that we can get data a lot faster and see outcomes is in pregnancy because it's a
Mhm.
short space of time, as we know. And so our system has been built in such a way that it captures a lot of information around pregnancy, but it's absolutely not the only thing that you can do on Aster. You can do absolutely everything. And we have providers that do more than women's health, do a little bit of family medicine. They do see some infants and do some peds work. We have a lot of women's health providers who are expanding. They're
Mhm.
seeing people for wellness services. They're seeing people for therapy services and having people in even for sleep therapy. So there's a lot you can do on Aster, but the takeaway is that it's specialized for women's health.
Great. So, my next question, which was coming into my head, I'm not going to ask that because you clarify in your last statement. I was about to ask, are you also thinking to widen your scope and include men as well in your system, or maybe a different system you'll create after the success of
Yeah.
and launch of that?
I think a lot of people ask, are you going to expand? If you did include men's health, if you did include that, it could be a lot bigger. I think one thing that we are very, very keen on is just staying within our niche and our
Mhm.
market. I think as we've both spoken about, there isn't a lot of people that are focused solely on women's health. And
Right.
we're happy to be that person. We're really dedicated. It's our area of expertise. That's not to say in future it wouldn't expand naturally. And of course, I'm sure that will happen eventually. But for right now, we know there is such a need for women's health providers, and that's where we want to focus all of our time. Yeah.
Great, great. So you know your focus, you know your vision. That is going to create an impact. Thank you so much, Laila, for such
Yeah.
gold mine discussion. Really appreciate your time and looking forward to talking to you again.
Thank you. Thank you so much,
Thank
Jazz. It's
you.
been a pleasure to be here with you.